Good morning to all the English speakers. It's nice to see you and to speak to you about through these new technologies, through this video. These videos has been recorded in order to try to provide you with a few information about top surgery, about the questions you generally ask us about the top surgery. Generally, most patients need to do double incision mastectomy because as long as we have generally most large and middle-sized breast, it's necessary to do this kind of procedure. Why not the other one? Because it allows us to get the better results in terms of chest morphology, male morphology, and avoiding any large scars, vertical scars, which are very uncomfortable for the patients. Okay, the double incision mastectomy consists in taking off the breast and the excess of skin, and for that we need to place a scar just in the pectoralis groove. That's the proper place to put this scar, because it's the place in which we can hide it properly in the future, not only because we are going to use static techniques, but because it's just below the pectoralis muscle, in the place in which is more high in the thorax. So that's the first steps of our procedure. In the second one, we are going to do chest liposuction. It's very important to do it as well, because with that procedure we can achieve the best result in terms of shape, of male shape of the chest. The male chest is not flat, it has its grooves and its reliefs, so that's why it is necessary in all the patients to perform that kind of liposuction, of chest liposuction, not only to treat the scar, to avoid these dog ears in both sides, but at the same time to provide the best result in terms of male chest, male shape of the chest. At the end of the procedure, we are going to take the graft, the nipple graft, and we're going to provide it a good shape, a good male appearance, trying to customize it properly to each patient. We are going to find at the same time a recipient bed in the male position, which is in both sides, and in that place we're going to remove the superficial part of the skin to put this graft in strong contact with the recipient bed. That's very important because it's going to allow us the viability of the graft. After that, the operation is finished. It takes around 4 hours to do it in the surgical theater under general anesthesia, and the apparatus is only for one night. But it's very important after this one night to rest, maybe not all the time on bed, but on bed or sometimes on the sofa or in an armchair for the first week after the operation, avoiding any chest or arm movement, because the graft needs to be properly nourished through diffusion from the recipient bed to the graft. You have to take into account that we don't have any large vessels that can be stitched. We only have capillaries, so that's why the graft is only going to be nourished through diffusion from the recipient bed to the graft. That's why we need to have a strong contact between both, avoiding in that situation any movement between the graft and the recipient bed. Because if in the case we could have a graft losing, which is not a strong complication, but in that situation we will not get the same result. So that's very important in that case to be very calm for the first week after the operation. After the first week, we're going to remove the special bandage, and we're going to put a special postoperative binder that need to be kept in place for the second week after the operation, after which we'll be in situation to remove the stitches and to allow patients to come back home because without any complication or any problem. Okay, nice to meet you, and if you have further questions, we'll be glad to answer you through the email of our hospital or through the new technologies such as the WhatsApp or whatever.
Okay, thanks.